I would like to start. I would request. I would like to start session 4, which is panel discussion 4, which is exploring the interplay in PCOS between sleep, memory, bone, muscle loss, and weight loss and physical health. I would request to join moderators Dr. Binal Shah, who is gynecologist. Dr. Binal Shah, she is a gynecologist, has received multiple awards as we can see, and Dr. Maulik Kinariwala, renowned diabetologist and and physician. I would request the panelists to join us on the stage. Dr. Somesh Chaudhary, Dr. Manoj Pandya, Dr. Jwal Banker, Dr. Shashwat Jani, Dr. Riddhi Shukla, Dr. Asmukh Agarwal, and Dr. Alap Shah.
Good afternoon, everybody. And after this sumptuous lunch, we have the task of keeping you awake from this slumber. Manoj bhai, please welcome on the dais. We are not going to leave you. And I'm really very excited to have a metabolic physician with me. So majority of task, I'm going to refer to him. And first of all, I would like to congratulate Kanti ma'am, because this is something like Duru ma'am is the mother who gave birth. And Kanti ma'am, so she's the Devki, and then, yes, and Kanti ma'am is like Yashoda who nurtured the baby. So the brainchild of Duru ma'am, that is the PCOS seminar, is being nurtured here in Ahmedabad. So today we are going to explore the interplay in PCOS between, you can see the topic which is so vast and varied, that is sleep, memory, muscle loss, bone loss, weight loss, and mental and physical health. Yeah, Kanti ma'am, you just came and I said that you are like the Jashoda Maiya who has nurtured the brainchild of Duru ma'am. And I welcome on board the expert panelists, and we are going to learn a lot from you. Dr. Somesh Chaudhary sir, gynecologist, Dr. Manoj Pandya sir, high-risk pregnancy expert and a car lover as well. Dr. Jwal Banker, fertility expert. He is going to be our savior today. And Dr. Shashwat Jani, I've learned that he's not well. So you all can take over his questions. Dr. Riddhi Ben is a very close friend and the cosmetic gynec surgeon pioneering in this field of cosmetic gynecology. Dr. Hasmukh Agrawal, fertility expert, and Dr. Alap Shah, the physiotherapist, last but not the least, because everything, the bottom line of management in PCOS is all about exercise and maintaining the body composition. So to this august audience, we are all aware that PCOS has almost a 26% prevalence in today's world, and in our OPD we see so many girls who are PCOS, often diagnosed late, often misdiagnosed or wrongly diagnosed. And it's the common cause of infertility. The sad part is that it is prevalent in the teenagers, and it increases the risk of diabetes. And one more sad part is that we normally forget a PCOS once the fertility is done. है ना, उसको बच्चा दे दिया और हम उसको भूल जाते हैं, but we need not forget that she is at a risk to endometrial cancers 3 times more than her counterpart. And yes, PCOS is increasing at an alarming rate, and it is associated now with more metabolic problems, as 60% are obese, 50% are having fatty liver, more than 70% have insulin resistance. We all know these are the contributing factors, and this is the natural history. As the age advances, there are other different points which we have to focus. This is the 2-cell gonadotrophin theory, and we are aware about the aromatization and increase in the free androgens. And this is the triad: the defective aromatization in the ovary, theca cell hypertrophy, and normal cell aromatization. These are the biochemical evidences. And now over to Dr. Maulik bhai, because I'm just taking you fast through the entire thing, and now Maulik bhai will directly come to the topic.
Yes. Good afternoon, everyone. And outside, we are thankful to Dr. Bansal ma'am as well as the Dr. Dhu ma'am and PCOS Society of India for giving opportunity me and Dr. Binal Shah to just moderate today's session. See, so straight away, basically, I am just going to start first is the sleep. And I would like to know from Dr. Chaudhary sir, how we are going to basically the PCOS interpret with the sleep. And please share your observation.
Mainly sleep disturbances in PCOS are one of the common problem. I start with the obstructive sleep apnea, which is one of the major problem with the initiation of sleep disturbance and till anosmia, not able to sleep at all. So these are all problem in sleep, and that has to be evaluated and to be treated properly.
Right, sir. So as rightly mentioned, there are two things. One is a OSA, is obstructive sleep apnea syndrome, and daytime sleepiness. These are the very common problem women with the PCOS. And ultimately, if you are not going to treat, then the patient is going to having a risk of the diabetes and cardiovascular disease and complications, right? So here, basically, the woman with the PCOS, they are prone to having a sleep problem in terms of the difficulty in sleeping, restless sleep, RLS, daytime sleepiness, and sometimes basically patient having a difficulty breathing with snoring. So daytime somnolence also is going to be more basically common with the PCOS without PCOS. Sir, also basically I would like to know from you how you are going to see PCOS with sleep in your clinical practice, and which are the contributing factor basically as far as the sleep disorder with the PCOS is concerned.
Basically, obesity is one of the factor which is basically think that it can cause sleep disorder. But the study says that PCOS in patients, hormonal imbalance is a major factor.
Exactly.
Obesity and hormone, if they have done a study and they found in patients who are not obese also, they have also got the sleep disorders. So you have insulin resistance. We are hearing from since morning all the hormonal disturbance in the basically
Right, sir.
PCOS patient.
Yes, sir. Yes, sir. You can also.
Basically, because there are 3 or 4 factors. One is excessive sympathetic CNS stimulation. Second one is there is increased HPA activity, that is hypothalamus pituitary adrenal activity.
Exactly right.
Then melatonin metabolites, they are also excited in a higher amount. Then there is a cytokine profiles which is also altered. And the last but not the least will be, as Dr. Durusha madam has told, there is a adipokine dysregulation.
Exactly.
All these factors adds to the sleep disturbances. And when it comes to OSA, we have to differentiate between the central OSA and obstructive sleep.
Obsessive sleep apnea syndrome. Exactly right. Rightly, sir, mentioned by
That
Dr.
was
Leza.
bullseye by Manoj bhai. And just to add on a small point to it is about the psychological.
Exactly.
Yeah.
Apart from this hormonal imbalances and this insulin resistance, obesity, one of the psychological behavior problems in terms of the anxiety and depression, this is also one of the major contributing factors for the sleep disorders. So that we have to keep in mind. And already basically mentioned by Dr. Manoj rightly, there is a basically role of the cortisol and melatonin secretion. We all know melatonin is a natural sleep hormone. It's going to secrete from pineal glands, and in early morning basically the particularly melatonin is going to decrease, and during night time melatonin will increase. So patient having a ideally hygienic good sound sleep without like the quantity and quality of sleep also is going to make a lot of difference. And if once the sleep disturbance is going to be there, it is going to make a significant impact on the daytime mood behavior, cognitive functions, as well as for the psychomotor function also. So, and if you're not going to treat in a proper way, ultimately is going to decrease the productivity, and the fatigability as well as the attentional deficiency is going to be a major problem, and it will going to create a risk of the accidents as well as the for serious health issues in the future, right? So if we are going to see in a different way also, like PCOS is going to basically aggravate a sleep disorder. Similar way, sleep disorder in terms of the OSA is also going to aggravate the PCOS. So it's a bidirectional relation between the PCOS as well as the sleep disturbances. So here, if you are going to treat in proper way, then definitely basically we can decrease the metabolic stress, we can able to reduce the oxidative stress as an endocrine dysfunction, and by this way we can take care of the future risk of the cardiovascular complication in terms of the diabetes, the particularly dyslipidemia, and a cardiovascular disease.
As you rightly said, Maulik, see basically sleep-wake cycle, it is affected by endocrine disorders, and endocrine functions are also affected by sleep-wake cycle.
Exactly.
So it has got such a bidirectional effect that unless until we address this issue properly, PCOS will not be controlled.
Exactly. Sir, just last the management part, again Dr. Chaudhary sir, basically how we are going to manage these sleep disturbances with PCOS in your clinical practice, and what are the guidelines going to be there?
First thing we have to find out it is a basically because of PCOS or it is some psychological problem.
Exactly.
We have to differentiate these two. If it is a PCOS, only because of PCOS, then the treatment of PCOS, you know that if she is obese, you have to decrease the weight, you have to change the lifestyle basically of the patient. In the if you give drugs, in drugs there is not much of drugs which has been given. Anxiolytic, giving sleeping drugs, that has not been recommended basically in these cases. And few more things. Then that is a CPAP and other thing. If there is some breathing problem, then you can add on basically with the CPAP and Adit.
Exactly.
And sleeping
Anybody
room
would
and
like to add on to that? Yeah, Riddhi-ben.
So one more important thing is, because we have seen that what is the whole spectrum of the effects on the PCOS patients. So when patients come with the irregular period, just don't restrict yourself to the period regularity. Even if patient is giving history or not, you have to positively ask about sleep, memory, weight loss, weight gain, her changes in the lifestyle, her performance in the academic or at the work. So even if patient is coming for any one most bothering symptom, it is a healthcare professional or a whosoever they are presenting for weight management, they might be presenting to endocrinologist or a physiotherapist. So we have to evaluate a young girl or a female or a older women as a whole. So you positively ask that, do you have these problems? And in one more important thing in a sleep, now every problem there is a grading system or a scaling system. So try to scale them or grade them so that, because you have to show the result. So that then only you are aware whether whatever therapy you are giving, whether sleep melatonin secreting pills or a CPAP or something, whether there is improvement or not. So whenever you are putting up any symptoms, please try to scale them and then see what is the effect, whether on the scale they have reduced or not. That's it.
Exactly.
Straightway before jumping onto the medication, I would like to examine the patient from OSA point
OS,
of view,
exactly, right.
because they might be having retrognathia, macroglossia, tonsillar hypertrophy, or maybe having lateral tonsillar narrowing, which may be
So all the
additional
anatomical causes.
Anatomical
Yes.
causes to be ruled out
Yes.
before just going to offer for the CPAP
And-
directly. And before going towards
in the
CPAP, sir,
literature, there is written some apneic hypoxic index.
exactly. Sir, it's a AHI index.
AHI.
AHI index.
Which differentiates between obstructive
Well, ultimately,
sleep
AHI
disturbance
index,
and
that we are going to come to know by doing the polysomnography. And now the mobile sleep lab is available. If you are any highly suspicious of the OSA, your patients with OSA, we are going to share the contact. You can call them, they will come their home and they will do sleep study. And once the AHI index is going to more than 20, then you can put a label patient having suffering from OSA. And certain symptoms like daytime somnolence, night time basically suddenly choking sensation. There is a snoring. Snoring is a physiological phenomenon also. But if snoring is going to obstruct the sleep, and if there is a you can going to observe it. Can like sleeping partner is going to give the basically proper answer. Like whenever you have a doubt of OSA, always ask the sleeping partner because इसकी स्लीप कैसी रहती है, वो रात में चॉकिंग करते हैं, बीच में स्लीप उसकी साउंड एकदम कम हो जाता है, सम टाइम लाइक जस्ट मोटरसाइकिल फिनोमेना इज गोइंग टू बी देयर. तो सच टाइप ऑफ द थिंग्स इज गोइंग टू गिव क्लूज टू रूल आउट OSA. And then basically you can confirm with the basically this sleep study, and once OSA is diagnosed, then after doing another problems you can offer for the basically the CPAP machine if having a severe OSA. Mild OSA you can treat with even temporal basically the splint is available in the market also. So this is all about the sleep, how we are going to manage. But at the last but not least, the lifestyle modification is a pivotal role for management of the PCOS as well as with the obesity with the sleep disorders.
And the bottom line is that they need to reduce the electronic device usage, because now the mobile and everything has become so rampant, especially the young age group children. They are working across time zones, across geographical boundaries. So they are working remotely in US, so they are working as per their time zones, and they are waking up entire night, and then they say that we are compensating it in the day. But that is not the same. As Dr. Maulik just now said, that there is a particular time during which the melatonin is being secreted. So suppose you have a 7-hour sleep in the daytime, is never going to compensate or be as restful as a night sleep. So that's very, very vital. Yeah, thank you, Dr. Maulik, for taking, because sleep.
This smartphone has a beautiful sleep.
The screen light can be changed.
App. So I usually ask my young teenage girls to make, because it is difficult to make them to not to use mobile, but when you put them that you download some sleep app and then monitor, then automatically that will be a self monitoring, and they realize that okay, this when I am sleeping during the day, it's not going to help and it's very unhealthy.
Yeah, and there's that blue light filter, though the light changes after certain time. So because this blue light would reduce the melatonin, so that those filters are there in the smartphone. Now, talking about something which is, very, very fundamental to this entire syndrome, I must say, metabolic, and something which is very close to my heart. So I'm talking about fitness. And yes, fitness is not only one thing, it's about entirely a body composition, your agility and your strength. And I must say that body composition is a much better indicator of fitness than BMI. We used to normally compare ke iska aur iska BMI kya hai, but just height as per the weight. No. I mean, it is as per, like, you may sometimes say that mera weight ज़्यादा नहीं है, मेरी height मेरे weights के लिए थोड़ी कम है. So some joke of that can be done. Changes in body composition which are happening in PCOS, their impacts on the health, and mainly my focus will be osteoporosis and sarcopenia. So when we talk about body composition, the first thing which comes to our mind, कि उसका body कैसा है, तो the first thing we think about is slim or fat. So what comes to our mind first is fat. But dear friends, what is very, very vital to the to body composition is the bone, the skeletal framework of the body. And what we are often forgetting is the lean body mass, that is the muscles. Right? As you can see in this diagram, there are two females given. Both have the same BMI, 22, right? But can you tell me who is fitter of the two? The younger girl, right? Because you can see the body fat percentage. This is the curve. You can see the body fat percentage, which is much less in the younger female. You can see the visceral fat index or visceral fat level, which is much more in the elder female. And the skeletal muscle. The skeletal muscle in the younger female is 26%, whereas in the older one is 20. So in spite of having the same body mass index, you can make out that which person is fitter as per the body composition. And as we all know, the osteoporosis is a silent disease characterized by microarchitectural deterioration of the bone, which results in fragility and fractures. And this can be a major cause of decreased quality of life, morbidity, and mortality. Now coming to the bone health, bone is an active, connective, and endocrine tissue, right? We always thought that it is just a dead thing, but no. It is an active endocrine tissue. It is influenced by a wide variety of factors like hormones, physical activity, inflammatory factors, dietary components, and the body weight. And PCOS is associated with disturbances in androgens, estrogens, insulin resistance, obesity. It is having a state of low-grade chronic inflammation. Just now we heard about gut microbiota dysbiosis. So all these can either negatively or positively affect the bone metabolism. So Dr. Manoj, you have been very active in the panel since the beginning, and I would like your opinion.
Should I become inactive?
Yes, please. No.
No, should I become inactive?
I appreciate that you are actually into it. So what is your opinion? Is PCOS bone protective or bone destructive?
I will say both.
Okay.
It is to an extent bone destructive and to an extent because of late there are many papers which have come as obesity having an advantage to have a good bone mineral density. So if we consider that PCOS being related to hyperinsulinemia and insulin resistance, basically physiologically if we see insulin is an anabolic hormone. It has got a very positive effect on the bone, say it increases the osteoblast activity, it increases collagen synthesis, it increases the osteocalcin activity and decreases the osteoclast activity. But whenever there is a hyperinsulinemia and insulin resistance, it negatively affects the bone and it affects the bone remodeling. The insulin, along with hyperinsulinemia, it is the hyperandrogenemia, which also again it alters the cortisol level and thereby it affects the interleukin 1 and tumor necrosis factor alpha. But androgen still we consider that testosterone is helpful for the bone, but it has got positive effect only when there is normal estrogen, normal progesterone and routine menstrual cycle.
Wonderful.
And the third reason is altered LH-FSH activity. Then again same comes to estrogen. Estrogen is a bone protective, but when estrogen is less, again it will be harmful to the bone
marrow.
Yeah, so it's
Then-
a relative estrogen deficiency.
Yes, then Dr. Fagun nicely told about the vitamin D, which is again, if vitamin D deficiency is there with PCOS, along with parathyroid hormone, because ultimately it is going to increase the parathyroid hormone and it will affect the osteoblast and osteoclast activity. And last but not the least, it is the growth factor. Insulin-like growth factor will be decreased.
IGF.
And again it affects the cortisol level. But still two more factors which I will like to add. Systemic inflammation.
Inflammation.
And because of the PCOS and obesity, there is lack of physical activity. To maintain bone mineral density or to build up, you require a weight training and strength training. But because people are obese in PCOS, because of the depression, anxiety, they may be having lack of motivation to do exercise, and that
Wonderful.
affects the bone.
Okay, thank you. So we are coming to that. Wonderful, Dr. Manoj, you summed up very nicely. So for the benefit of audience, I'll just brush up those things which Dr. Manoj enumerated very well. He is very right that androgens do have a positive effect on the bone if estrogen is present. But the adrenal androgen excess in PCOS can lead to chronic inflammation and bone loss, and estrogen deficiency can lower the BMD. Insulin resistance can lead to elevated androgen production, decrease in the osteoprogesterone expression, and increase in the Rankel expression. So all this will accelerate the bone resorption, right? So that balance of the resorption and formation will be tipped. Chronic inflammation is there, which adversely affects the bone health. Vitamin D deficiency has been very nicely discussed, and it impairs the bone metabolism. And definitely we need to supplement vitamin D. Going into the molecular biology, bioinformatics found that there were 70 intersecting targets and common pathways for PCOS and osteoporosis. So this is really so much, enlightening. And these core targets were the insulin gene, the insulin-like growth factor, threonine kinase 1, and the signal transducer and activator of the transcription 3. So what happens actually is that because of the leptin resistance and hyperinsulinemia, PCOS patients have a low BMD. High glucose environment alters the osteoblast activity. Osteoblasts are the ones which form the bone and induces osteoblast apoptosis, so kills those cells and thus reduces the BMD. IGF-1 is an osteogenic differentiation factor. It upregulates the expression of protein kinase and alkaline phosphatase and participates in anabolism and repair. AKT1, it mediates downstream pathways regulated by these pathways and disturbs this dynamic balance between bone formation and bone resorption. And STAT3, it also affects the formation of osteoclast and bone resorption activity. Again, what was very surprising was that the level of anti-apoptotic gene, that is FOXO1, was lower in the PCOS females compared to the normal females. So this was a very important and enlightening intersection which was found between the bones and the osteoporosis, right? So how they are interconnected. And now coming to a very important and vital part of body composition, that is muscle. Because often we tend to neglect that. We are always talking about osteoporosis, but muscle is probably left around. So skeletal muscle is a key metabolically active organ. It is the most effective organ for insulin-stimulated glucose uptake in the body. Right? So we always wonder, कि ये तो इतना सब खा रहे हैं, why she is not gaining weight, right? Or I am probably eating less than her, but why I am not able to lose weight? Because what is important is that muscle has to be there to burn out those calories, and muscle is the organ which takes up the glucose as per the instruction of the insulin. So muscle tissue is the most important element. Greater the muscle mass, faster energy, higher rate of metabolism, reduce oxidative stress, maintains the mitochondria, and definitely manages stress and boosts the confidence. So muscle plays a very important role even in type 2 diabetes, but I must say that there is very little information about how immune cells support the metabolic function in the skeletal muscle and what is the role of inflammation in modulating the skeletal muscle metabolism. So Dr. Shashwat is not here, so I would request Dr. Joel to take up this question, that please can you explain what is the interplay of muscle health and PCOS?
So muscle health encompasses many aspects like muscle building, muscle endurance. It can be cardiovascular health, or it can be flexibility. So 4 aspects are to be covered when we look at a muscle. In
Yes, so
PCOS
that we'll
patients-
discuss in the exercise, but what exactly have you seen, in PCOS patients, why is there the muscle loss, and what is the reason for that?
So PCOS patients have insulin resistance, and they have mostly they are obese. So the first obstacle is obesity, which leads them to not going for weight training exercises. But muscle mass is the most critical aspect when we look at controlling insulin levels in the body. There are studies which suggest thigh muscle mass is directly linked to longevity of a woman or for a man, for a matter of fact. So muscle mass will lead to better insulin resistance in the body, will decrease the chronic resistance in the body, and eventually will help in controlling the hormones. For
Okay,
PCOS.
great.
may- may- may I- may I
yes,
add?
yes, please, Manoj bhai, please.
So again, in muscle, again the same thing, hyperinsulinemia leading to increased sugar. Whenever we do exercise, sugar is not entering into the muscle cells, and that's why we feel lethargy, fatigue, tired, and muscle recovery is difficult. And that way it affects the muscle mass. Second one, it is the inflammation, which is acute and chronic. So androgen, hyperandrogenemia,
Exactly.
it favors the fat deposition into the muscle, which is known as myostasis. And it affects the muscle recovery and muscle formation also. And third one being this chronic stress and inflammation, say increased CRP because of the chronic PCOS condition.
Right. Can anybody enlighten me on what is sarcopenia?
I just wanted to add this insulin
Yes, please,
resistance,
please.
inflammation,
Yes.
and again the fat mass is there more.
Yes.
So metabolic rate is also less. Muscle mass is less, so that cycle keeps increasing.
Right. Yeah, Dr. Jewel, can you enlighten us on what is sarcopenia?
So sarcopenia is actually the decrease in the number and the size of the muscle cells in the body. And in patients of PCOS, they have a exactly sarcopenic obesity, which
Right.
means they have a lower body muscle mass, lower muscle cells, and increased fat cells
Fat as compared to that.
as compared to the
Okay, so
muscle
how
cells.
PCOS is linked to the sarcopenic obesity? Like, why is it so?
So,
Why does
I
a
mean-
person with PCOS have this?
So there is a central obesity, pear-shaped obesity, and because of all these factors which we discussed, like insulin resistance, chronic inflammation,
Yeah.
increased cytokine levels.
Yes, so almost the panelists have, summed up everything. So PCOS patients are definitely at an increased risk of sarcopenic obesity due to insulin resistance, chronic inflammation which causes muscle catabolism and sarcopenia, elevated cytokines as Dr. Manoj said, interleukin 6, TNF, which decrease the muscle growth and increase protein degradation, reduced adiponectin which can worsen the insulin resistance and muscle loss, and increase visceral adiposity. So there is more fats on the viscera, which Dr. Alap added. So all this leads to elevated levels of cytokines and leptin. And going into the molecular biology, there are changes in the DNA methylation which affects the gene expression in the skeletal muscle. There are epigenetic and transcriptional changes in the skeletal muscles which explains the metabolic abnormalities. There are defects in the early insulin signaling, and there is fibrosis in the skeletal muscle which contributes to the insulin resistance, and there is immunomodulation pathways are dysregulated in skeletal muscles. So these are the main reasons why this is happening. The insulin signaling defects, it basically contributes to reduced glucose uptake and metabolism. And when we give medicines like metformin, which modulate the insulin sensitivity, we know that metformin is an insulin sensitizer. So it modulates the insulin sensitivity via the AMPK pathway, and exercise, it improves the insulin action, right? It makes the body more receptive to insulin, and that is why we recommend these for managing PCOS. So any of the panelists can take this, that how can we improve the muscle health? We know that the muscle health is not good. So how would you recommend, and especially I would like Dr. Alap to take the lead, that how would you recommend a person to improve the muscle health?
So the resistance training is key to success. Strength training exercises, open chain, closed chain. Individual approach would vary. When a beginner is there, we can start with mild resistance, moderate resistance, and keep increasing the repetitions. The weight resistance to increase either with dumbbell or small elastic bands, or working on the resistance training devices. A few of the important exercises, dumbbell exercises, leg extension, leg press, calf press. We would want to encourage using big muscles, calf, quadriceps, hamstring, glutes, pectorals, biceps, triceps. And this is one of the biggest missed opportunity we come across in the clinical practice, that most of the population focuses more on the cardio or aerobic based exercise, whereas resistance training is a missed opportunity.
Right.
For example, an osteoporotic patient is doing swimming, which is a fantastic cardio activity,
But
it is not exerting any gravity or no tension or load on the muscles. Like Dr. Pandya said very well, in some research we have also seen the fat obesity acting as a positive precursor for acting as a bone loading and improving bone mineral density. So we in our clinical practice keep telling that these people who are obese have good bone but bad joints.
and the vice versa.
So resistance training is something big time should be incorporated. For example, like we come across patient who walk 60 minutes in insulin resistance. or 90 minutes. In fact, we are beyond the point, beyond 30 minutes, 40 minutes.
There's no
All the
extra
research trials are showing that when we perform cardio exercises, we are losing muscle mass. So it has to be a fine combination. And when we are talking of pure muscle health, we are talking of pure resistance training, open chain, closed chain, equipments, body weight resistance, compound activities, squats, lunges,
Wonderful.
rotational activity, torsion, twisting. We involve multiple planes. Even single plane will not be effective. And once those are, we clearly see changes in the lean mass on the, like this first presentation slide was very good. Rather than BMA, body composition is more important. And
Yeah.
we see lean mass changing, and we see insulin resistance changing, and we see drastic results in all the parameters that we are looking at.
Wonderful, Dr. Ala.
Binal,
Yes,
in
please.
spite of such a clear idea, we always wonder why our patient fail to go for the exercise.
Right.
Or rather why they don't persist with the exercise. So as a clinician, it is our imperative duty to stress upon the fact or to go into the detail about the various individual circumstances, like say social, cultural, economical condition of the patient. What are her or his preferences for the
Right.
exercise? The third one being what is his physical capacity? And fourth one being, is there any comorbidity in that patient?
Exactly.
So that even if we have sent it to a physiotherapist or we insist, if her capacity is less, she will never do that exercise. And the last one, but the most important from the infertility and everything, what is our broader management goal?
Right.
And that way we can give a exercise prescription considering this FIT criteria, which is frequency, intensity, timing and everything.
Wonderful,
So as
Dr.
a
Manoj.
clinician, we have to also interact with the
Yeah,
And
yeah.
also, sir, we have to
As
keep
sir
it
told, you have to prescribe the exercise.
exactly.
Yes.
You have
Exactly.
not to advise the exercise.
Essay
True, true.
prescription is going to be
Wonderful.
there.
So yes, so really appreciate the panelists and thank you Dr. Manoj for that holistic view, because it is just that exercise करके आओ 5 किलो वजन घटा के आओ, that's never going to work, you know. You have to actually guide her and also go into the detail that why she is not able to follow it. Also see the social circumstances, the financial circumstances, and the personal, you know, limitations, because every person can, I mean, you cannot, this is nothing like where you can compare. So really appreciate and thank you Dr. Alap for bringing this out, because I would like to, discuss this very in depth, that there are 4 different kind of exercises. First is a cardio respiratory endurance. So majority of us do walking, jogging, cycling, aerobics, HIIT, so they fall into the category of cardio respiratory. They improve the heart conditioning and the lung conditioning, right? Because the heart pumps better, the resting heart rate is slower, it increases the sensitivity to insulin, prevents diabetes, reduces the blood vessel inflammation, reduces the colon cancer. So it is ability to perform prolonged large muscle dynamic exercises at a moderate to high level of intensity. So this is cardiorespiratory. The second type of exercises are which will increase the muscle strength. So that is amount of force a muscle can produce with a single maximum effort. Right? Suppose for example you want to throw something. So this keeps the skeleton in proper alignment. It prevents backaches and leg pains, and here it gives you a higher rate of metabolism. Right? So here comes strength training, resistance training, weight training. So even you can lift definitely dumbbells. If not, you can even lift filled water bottles. You can have resistance band. You can Amazon say order करके you can have. So this will increase the muscle mass and function, right? And this reduces the risk of osteoporosis when we are doing weight training, right? In the older times, the females in the village, they used to lift heavy full ghadas on their head and walk, right? Heavy anklets in their ankles. So this reduces the oxidative stress as well. Now what is muscle endurance? Here the muscle has to hold the contraction for a long time or to contract a muscle over and over again. Like for example, half glass में पानी में कितना वजन है? Nothing. But if you hold that half glass for half an hour, then that tests the endurance of your muscles. So this is important for good posture and injury prevention, and this copes up with the daily demands and enhances your performance in work and sport. So this you can build with training with weights, calisthenics, push-ups, planks, curl-ups and everything. And this I would like to just not speak but give actual demonstration. Music नहीं आ रहा है. इसलिए आपको बोला था ऑडियो आउट देना है, ऑडियो चेक करना है. Pardon? No, this is proper gym. Not actually, I have a video for it. So. No, not now, right now. Right.
Till Binal, when till video comes, I will like to highlight for
Yeah,
the
please,
muscle
please.
exercise also.
Please.
I don't know whether you were there or not, but when we are advising the exercise sessions, we should insist upon the repetitive session,
Right.
because if it is not done for 3 days,
Right.
whatever insulin sensitivity advantage we have achieved, it will be gone. So we have to make the difference between the physical activity and exercise.
Right.
बस खुद की सुनता बातें ये नादानी से है नाते ये गुर्राता आते जाते ये दिल को कहता ये राते ये वो देखे हैं आंखों में किस्मत की आंखें डाले हैं हवा के कानों में जाके कहे किस्मत बिनती है दिल ये जिद्दी है दिल ये जिद्दी है दिल ये जिद्दी है जिद्दी है दिल ये जिद्दी है दिल ये जिद्दी है
Yeah. Thank you. Thank you so much.
Motivation.
तो मैं वही बोल रही हूँ कि डोंट कंपेयर, दिस इज जस्ट एन एग्जाम्पल ऑफ वेराइटी ऑफ एक्सरसाइजेस.
By him.
No, it has to be individual and supervised.
Exactly.
You will be surprised to know if anyone knows this Bollywood heroine Rakul Preet. 6 days back, while lifting 80 kg deadlift, she got major slip disc, and since 6 days she is absolute bedridden.
Right.
Absolute bedridden.
Yeah, so nothing
So-
has to be done unsupervised, and you have to go gradual. You have to know your limitations. Like from the day one, I was not doing this, but over a period of years, like I have been a sports person from the beginning. Like I went till state level of swimming and basketball and volleyball and all in school. So what Duru ma'am also said that you have to make your children active into outdoor sports from the childhood. So and I used to always cycle my way to my school. Like I never used to go in a rickshaw or a van or something. So as such, I was into physical activity from the beginning. Then I was into yoga and walking. Then gradually 10 years back, I started gym and all. So this is like the way you go, and your bones and muscles and everything have to support you. And very, very important thing now, the fourth component of exercise is flexibility. You may get the strength, but then if you are not flexible, then there is a lot of problem in your day-to-day work. So flexibility is ability to move the joints through their full range of motion. Like अपने पेशेंट्स कहेंगे कि मैडम मैं बाल भी नहीं काट सकती, मैं ब्लाउज के लिए हाथ ऊंचा नहीं कर सकती, आई हैव फ्रोजन शोल्डर. सो लॉट ऑफ डिसेबिलिटी इज एडेड टू देयर लाइफस्टाइल. So depending on the, it depends on the joint structure, elasticity of the tissues, and inactivity makes them more stiffer. So what is important is a pain-free joint, and for this, yoga is something which is, there is no comparison. And yoga and all the stretching exercises, they help ensure the full range of motion, and also balance. Balancing is also very important, because as you age, you have problem with balancing. So like such exercises where you have to stand on one leg and all, it improves your balance as well.
And addition to that, before going for any basically weightlifting or the muscle standing exercise, in middle age group of people, basically particularly women, we have to go for the cardiovascular assessment and the full body profile checkup, because suddenly sometime is going to having a trigger in the cardiovascular events also, and that we are going to heard in day out basically in our newspaper and even also in society also. So
Yeah.
this is also basically the take-home message we have to keep in mind. Don't go for aggressively. If your patient want to do it, better do some cardiovascular assessment. Everything we have to clear out, and then we can allow to do it.
Yeah, so don't become like weekend heroes, suddenly on the Sundays, suddenly you want to go for a 30-kilometer cycling, and in the weekdays you have not done anything. So that your heart and lungs and everything cannot take up, and we have the news of MIs and all. Yeah, exactly.
Daily, yes.
So,
ma'am
so
is
there
rightly
is
told.
proper 45-minute, 1 hour assessment is done.
Right.
When a
Exactly.
beginner wants to start,
Yes.
which includes everything: flexibility, cardiopulmonary, his or her response to specific cardio or strength in terms of blood pressure or heart rate variability.
Right.
So entire assessment, comorbidities, as he said, surgical history, medical history, and then his or her goals are made. If somebody has not exercised ever, then walking is also good exercise. But
Exactly.
if somebody is walking for 3 months or 6 months, then there is a principle of overload that he or she has to introduce to get the additional benefits.
Right, agree. And there is a safe heart range, like 220 minus your age. So, and you have to perform only 70 to 80% of that.
Exactly.
Yes.
Submaximal heart. Okay, right.
Over to Dr. Maulik.
Yes.
Carvonance formula.
Okay.
Very well used.
So thanks to Dr. Bilal and all panelists. We have a very good discussion about the bone health and muscle health. Previously we have discussed sleep. Now few basically the slides about the PCOS and memory. As far as the PCOS memory concerns, we have a very less literature, but madam basically has given the task to just discuss on PCOS memory. So just basically we are going to know from Dr. Hasmukh sir. Sir, how the PCOS is going to interplay with the memory loss?
In a PCO patient, we had seen the many patients, they had the problem in the memory, they are on the high risk of the memory loss or memory disturbance. They are the problem of the attention also. Sometimes there are the studies showing that they are the loss of the white matter in the brain, which reflect to disturbance of the memory in the middle age. Today morning one girl came to me, she told, उसके पप्पा बता रहे थे कि भूल ही जाए छे. Today topic was with me.
So you actually had a practical demo of that.
So I explained her father that this is not problem with the girls, this is a problem with the disease. You take care of this disease part. If disease part will be take care, then her problem will be solved. Otherwise she will be neglected. That parents will think कि इसके दिमाग में कुछ बरोबर नहीं है, इसका दिमाग ठीक नहीं है, और they are searching for the other thing. But once we all clinician guiding properly, it is not a problem with the brain, but it is the problem of because she is very obese, irregular cycle, scanty period. For that purpose she had came to me. I think we will correct that part, then the memory part will be corrected. We have seen many girls in the middle age that they had the obesity, PCO, and they have the memory problem.
Exactly. Yes, sir. Yes.
PCOS being a chronic condition, when a woman of PCOS, or rather say from fertile age, she reaches the perimenopausal or menopausal age, by that time there are so many subtle changes which has occurred in the brain. In the form of the small infarcts also, and because of OSA,
Right.
hypoxia and hypercapnia. So that leads to memory loss and just okay.
And same sir, sleep is so much essential for memory. So PCOS, sleep and memory, three are probably
Exactly.
totally
So ultimately, it's all the basic metabolic disorder vicious cycle, insulin resistance, diabetes, PCOS, hypertensions, and ultimately is going to having a create a issue on cognitive dysfunction. And future basically there might be some underlying cardiovascular disease also is going to create a risk of the memory loss. So nutshell is here basically the female with PCOS having a brain abnormality at the regional as well as network level, and these alterations are going to associate with the serum hormones as well as the cognitive functions. Particularly PCOS, psychological distress and metabolic disturbances may jointly contribute to cognitive dysfunctions affecting executive function also, visuospatial abilities as well as the processing speed in affecting individual. So this is the basically somewhat sorts about the memory. Anyone would like to basically share something, the views from audience, they can also share the PCOS with memory, because there is a very few basic data once we have gone research for PCOS with memory. Anyone would like to add from panelists?
Particularly these three functions, thinking, memory and concentration. These are the three functions which are going to be affected with this.
Exactly.
So
This
basically the
it's a
memory-
cognitive behavioral therapy,
By
CBT.
cognitive decline means remembering, learning, thinking,
concentration,
rather arguing,
Processing and
Exactly.
retrieval.
decision making.
And majority of them are there in a career building
Exactly,
stage.
right.
So it is very important to evaluate them for these aspects also.
Right.
As I repeatedly said, just don't try to regularize the period and that's done. PCOS, as we all know, that it is affecting the whole body, from brain to all the part of the body, and of course it is a multidisciplinary approach. So please, 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 rather than just treating everything on your own,
Exactly.
involve the specialist, involve the colleagues for whatever things, because of course you can do it by, you can prescribe therapy, you can do these, that, but whenever necessary, please involve other colleagues as well and try to help them, mainly these brain functions, because this is very important. I would say anxiety, depression, memory loss, then cognitive functions, these are the things which always, majority of the times, remain neglected in a clinical setup. So please, we have to try to manage that also.
Yes.
Yes,
Okay.
wonderful.
Now, ma'am, over to you.
Yeah. So have you heard about from a pear becoming an apple? Yes. So pear to an apple is basically a change in the body composition where the body fat distribution changes and we have more abdominal circumference and more weight is there above the waist, right? And what exactly, Dr. Jewel, is the problem when we have this kind of body composition?
So I mean, this is actually the right line. It is not just weight loss, it is also waist loss. We want to reduce the central obesity around the abdomen,
Right.
which is more linked to insulin resistance and because of all these factors which we have discussed earlier. So the
Right.
patient should be encouraged to have exercise, weight loss, especially waist loss.
Waist loss.
Waist loss.
Yeah, so Dr. Jewel, you are very right, because whenever there is a central fat distribution, the pro-inflammatory cytokines increase, there is increased visfatin, decreased adiponectin and increased free fatty acids. All this leading to insulin resistance, all this augmenting hyperglycemia, dyslipidemia and hypertension. So all in all, increases the cardiovascular risk and increases the metabolic syndrome problems. So reducing a waist circumference through the lifestyle interventions like balanced diet and exercise can improve insulin sensitivity, regulate hormonal imbalances and reduce the risk of comorbidities, that is diabetes and heart disease. So can you enumerate more on how exactly can we do the interventions and in what way? Yeah.
So specifically for waist loss or as general summarize?
General, but please do focus because people are interested in knowing
So
about the waist loss.
That would be more focused on gearing increase in the basal metabolic rate process. So it will be a combination of 3 to 4 things: exercises, scientific nutrition, lifestyle modification and stress management, 4 pillars.
Right.
And in exercise also cardio around 30 minutes a day with proper warm-up, maintaining heart rate and conditioning, cool down, so where you get actual fat burning effect in a session. But in a session, we would not be able to gain much. So again, the role of resistance training will come here. So muscle breakdown, muscle repair, increased lean mass. Increased lean mass will result into improvement in the basal metabolic rate, resting rate, which will give us long-lasting results.
Yeah.
So we will not be able to achieve lasting waist loss without working on resistance training or body weight resistance training activity, because that's where during the activity or post few hours also we keep getting that results.
Yes.
And then comes the nutrition, whatever we do, but if that deficit we can't create, then we are not going to get the results. So that is low glycemic index food, low inflammatory, anti-inflammatory food, which is now
Yes.
one of the most discussed topic across the world.
Right.
Which containing omega-3 with
Wonderful.
The ma'am, Durusha ma'am ended with this very fantastic word, gut dysbiosis.
Yes.
So it is a future which is leading to inflammation leading to PCOS. The minute we start working on regulating gut biosis by anti-inflammatory diet, the drastic results are going to be
Yeah,
there.
you're very right. This is why we have this mushrooming of PCOS.
That's to improve gut bios,
PCOS.
simple thing like dahi.
Yeah.
But-
So,
Yeah,
Yeah.
so
Buttermilk curd.
yeah, I've even heard that those fecal capsules are also going to come. So probably, so yes, you are very right that suddenly we see this mushrooming of PCOS in this young generation. I call them Maggie generation. Often we have seen the mothers who are in their 40s are more fitter than the adolescent daughter who is in their 20s, right? I mean, we have seen so many of them, right? And you're very right, Dr. Alap, that we have to give something which keeps the metabolism high even after the workout is over. So you don't limit your calorie burning only to that 1 hour of session of the workout. So you're very right in that. And yes, cinnamon also helps up. Yeah, so those are the superfoods. Cinnamon, even methi. Like, you know, olden days we used to, and I mean, I still do that. Raat ko methi bhigo ke, subah methi or methi sprouts you can have. So many of these things would add. Probably Dr. Maulik is going to discuss all that in the end.
I think many people, when you tell them to lose waist,
Yes.
वो कहते हैं कि हमने 3 साल से रोज एब्स कर रहे हैं
सिर्फ एब्स से नहीं होने वाला
I mean that is one
that's a myth.
message.
That's a myth कि सिर्फ एब्स करने से एब्स नहीं आएंगे. मतलब so
So
doctor,
from adolescent to postmenopausal, any women, any girl, they are always concerned about their abdomen.
right.
Everybody is concerned about waist. जब उनका waist size change होता है, then suddenly they realize that my weight gain,
So it is
my
kind
weight
of
gain has happened.
So
So
that's
we
a-
have to emphasize also that ये waist reduction का scientific क्या है. So maybe initially they are not able to reduce on the scale, but if they are reducing waist circumference
is-
by
yeah.
inch loss,
Inches
then
loss
we have
also
to
is
keep
important.
motivating them. So I usually start with that I emphasize more on a waist of any young girl and anybody. So once they start having each loss, and probably that is the time they gain confidence in themselves, and then you can motivate them to have a weight loss
Yeah.
as well.
So to echo with what ma'am said, fat loss would be more important than weight loss.
Yes.
loss.
Because then there are subgroup of population who follow aggressive diet and some hyper cardio activities, and when you compare their body composition analysis, they have lost weight, but they have lost lean muscle
Lean
mass.
muscle mass,
Yeah.
exactly.
Which is one of the, I mean,
Worst things to
worst
happen.
indicator
Right.
of declining fitness by declining weight. So fat loss would be more appropriate terminology than weight loss.
Actually, our phenotype also is a little bit different, and is always we are going to get little bit resistance, I can say, basically to reduce come to the central obesity. So it is a lot of the efforts would be required. Without only with the one thing, we cannot able to reduce our central obesity.
Yeah, this is some exercises for abs, and this is not at the gym. It is at my home only.
You ready? Let's go.
Yeah, and you were very right, Dr. Alap, that said that only doing abs is not going to help. You have to entirely work, and especially that suggestion about the diet is like very, very vital, because the major problem which is happening in today's generation is the diet which is being followed, and this maida and refined flour and all the packaged foods which has led to all this problem. And so simple homemade fresh food, more of fibers, salads, millets is creating wonders in these females. And yeah, so thank you for that as well. So combination of aerobic exercise, strength training is particularly important. And for diet, ma'am, I can again talk for 1 more hour if you give me some other time. And even a modest weight loss of around 5 to 10% can lead to significant improvement in the metabolic parameters, that is the insulin resistant, lipid profiles, hormonal balance, even fatty liver, SGPT levels, because NAFLD is also something which is coming up big way in this metabolic syndrome. So weight loss can also have positive effect on the psychological well-being. And suddenly when Navratri approaching, I saw these ads on Instagram, that do you want a, itni kamar chahiye, ye, wo, they were advertising. So it is like, so for, in 7 days, you can have, a kamariya. So it's really, something which will attract that they will have a positive impact on their about self-esteem and body image. So over to Dr. Maulik for the mental and physical health.
Yes. This is our today's last topic of the basic discussion, and then we are going to keep the house open for the question answers. Now the mental and physical health. I would like to know from Dr. Riddhi Shukla ma'am, PCOS female madam, how are going to basically see PCOS with the mental and physical health, and how we are going to treat in your clinical practice. Please madam,
So
elaborate.
now we all know that physical and mental health, they are, it is an interplay always. And nowadays, WHO has said that maximum cause of death would be a depression. rather than any physical illness. So mental illnesses and psychological problems should never be undermined. I have a huge population of young girls, usually more than 100 kgs. Every month, maybe I am getting 2-3 young clients like this age. So practical tips I would like to say, when they walk in your, in your consultation, usually they do not have your eye contact, they are looking down, and as you said, that they are usually with parent, mother is talking a lot, ये नहीं सुनती है, ये नहीं करती है, ये नहीं खाती है. So what I do in my clinical practice, सबसे पहले मम्मी को बाहर भेज देने का, ask them to do a what we called is a blind weight, that I ask her to do a weight and do not disclose this to anybody. And for initial 2, of course you explain them that what is a PCOS, how it is going to affect the whole thing, how lifestyle modification is helpful, how your physical and mental health is interrelated with each other. So at least by not ignoring her mental health, of course, so boosting her self-esteem is extremely important. So of course PCOS guideline has been talking a lot about. So what I do is usually I write a one long word, it's called SMART. SMART. So I tell them that you are smart enough and you should have to fulfill this. So SMART stands for you give them so you inquire in detail about their lifestyle. Food, what are they eating? I had one client that she was having PCOS, not very BMI, but she was, dessert lover. 80% of her food was dessert. Okay, so her HbA1c was very high in spite of low BMI and everything.
Right.
So you have to get in detail about their physical activity and diet, and then give them a SMART means specific, measurable, attainable, realistic and timely goal. Okay, for that young woman, that time in spite of anything, her HbA1c and sugar control was very important, timely. So I usually explain them, and you have to tell them, to the mother and to the young client also, that this process will take 2 years to come back to a normal level, because as you rightly said, that when young girl is above 100 kg, if you will tell them, okay, exercise karo, lose weight karo, and then come back, it's not possible. So you tell them that at least by losing 5% of weight,
5% of weight also will get.
Also it is going to help. So you just give them a short-term, realistic, attainable goals, and then that will help it to boost their self-esteem, and you are taking care of her physical and as well as mental health. So this is very important. So just don't try to do everything, exercise bhi karna, khana bhi. So try to do one by one, because those who are having mild depression, anxious, poor performance, heavy weight, more than 100 kgs or obese, for them to do everything in a month or 2 or 6 months is not possible.
Not possible.
Rightly
So give them one by one goal and try to balance physical as well as mental health both together.
Rightly said that self-esteem is an indicator of the physical and mental health. And PCOS lady, they have to fight at twofold for the self-esteem, because being a chronic disease, they have to manage it for a longer time, and second, associated symptoms. So because of this, they may be having bipolar disorders, they may be having OCDs
also.
They may be having somatization.
Somatization also.
So they keep on complaining pains everywhere.
Right.
And the last one is eating disorder, and as you rightly said, younger, it is a disordered eating rather.
Right.
So all these conditions leads to again a low self-esteem, and here comes the CBT, that is a continuous behavioral therapy.
And what is important is not to make her feel humiliated, and she doesn't require sympathy but empathy.
That is from the
you have to
family and
encourage.
as well as from the doctor.
Right, wonderful.
Exactly. The cognitive behavioral therapy and basically mindful, basically the programs is also going to be a very helpful role, basically overall about the basically to improve their mental as well as the physical health. Now we have discussed a lot many about the diet and physical activity and lifestyle modification, we all know. But I would like to know from the Dr. Riddhi ma'am, sir, apart from ma'am diet and the physical activity, which are the other basically this was, because nowadays lot many booming for this diet, this meal supplementations, even the multivitamin replacement or any alternate therapy.
So very important is the first counseling whenever patient walks in. So you have to counsel them a lot. You have to make them aware about what is PCOD. I have a full presentation on my computer all the time I am showing. Give them a time, because first consultation, if you are explaining them everything, then consequent consultation and their management will become easier. I have formed a support group of my patients. So PCOS club I have founded on my, so that help one patient, because I had a patient, she lost 20 kgs wonderfully, balancing, managing, exercise and everything. So that I do ask her that you give me a video, or this is a group where you can post this video. So you form a support group amongst the client, as well as you can involve nutritionist, yourself, physiotherapist, so they can help them to deal with day-to-day challenges. And then diet chart and nutrition chart has to be individualized. One thing is not working for everybody. Okay, as Dr. Alap rightly said, that BMI. I had a patient, and I know a nutritionist, she is a close friend. She said कि fasting करने से weight loss कभी नहीं होता है. So just don't skip the meals. You have to, what is important is a BMI. Now हर एक patient का BMI differently increase होता है. So you have to, one diet will not work for everybody. So specific diet, of course, for a mental. So I usually ask my client that what do you like? Do you like dancing? Do you like Garba? Are you into cycling? Are you into swimming? So whatever is her liking, that specific thing you should ask her to motivate. Jesse, I myself doesn't like to go to the gym. I can do dancing, Garba, whatever into. I am a classical dancer also. So gym is not a solution for everybody. So you have to ask them what is their liking. And then similarly, there are so many meditative apps, and this young generation is very app friendly. So for their mental health, there are so many programs also. So rather than just phone नहीं इस्तेमाल करो, उससे अच्छा है कि phone you should use for a positive things. You know, there are apps which help them in their mental mindful.
With regards to mindfulness medicine program, it should be a mindfulness-based stress reduction program.
Yeah.
Exactly.
And second one, with regards to this cognitive behavioral therapy, if you start that, it will help three ways. First, it will reconstruct their behavior, which was changed due to the low self-esteem. Second, it will help to have a healthier mind. And third, it will reframe their thought processes also.
Yeah, it will program the subconscious mind,
Yes.
and that will resurface, and that will help her much
Increase
more.
and
Yes.
and simultaneously, if you start with the resistive active training, it will increase the physical vitality, capacity, and social functioning.
And rather than supplements, you should encourage them to have a complete meal full of vegetables and proteins.
Right.
That's it.
So your prescription should not be a punishment, but she should enjoy and try to fulfill it. And so thank you so much, panelists. And yes, I mean, we really would like to resonate to Dr. Kidson, who said that PCOS is the thief of womanhood, and PCOS affects women's reproductive, metabolic, psychological, dermatological, social, and many more aspects into her quality of life, and focusing holistically on weight loss and weight maintenance, which is very important, through a tailored diet and exercise intervention can enhance overall health outcomes for the women. So thank you so much, and I hope everybody enjoyed. Thank you.
Thank you.
Thank you, Binal. Thank you, Maulik.
Thank you. Can we